All right, hello everyone. We are now going to enter our study session this evening. We'll have a chance to talk and discuss kind of more informally and openly about certain topics. And tonight we on the agenda is we're going to start with a bit of kind of a review of the strategic planning refresh and kind of what we're trying to get at with our current efforts of reviewing the strategic plan. And then we'll talk about school reopening plan parameters and get an update from Dr. Reed on all the different issues and topics that we are looking at and dealing with at the moment. So I will go ahead and turn this over to Dr. Reed to begin.
Thank you, President Swain. Tonight, it's important, I think, that we take an hour to look at these two really important topics. One, the strategic plan really charts our future. It's our 5 years out plan, and it's important that we're really thoughtful about that as it sets a direction for the entire district and the experiences for our students. So I was on a phone call this morning with Hvac, who's helping us and coordinating this work, and also North Assistant Superintendent Obadiah Dunham, because the North region's done some work around Portrait of a Graduate, and we've talked about that a couple different times. And so that's work we're going to be doing, as you know, for the entire district. And we'll be talking about that at our ATM meeting in February, which is our administrative monthly meeting with all principals and administrators in the district. So that'll be a topic of conversation. Also, Mutu is going to return on January 25th, either during our retreat time or study session time with the board. We're also coordinating with staff from the Gates test pilot program for our COVID diagnostic testing to join us for either part of the retreat or the study session. I just want to make sure everyone's calendar lines up on the 25th, but I'm sure that'll be a busy day for us. And on the 25th also, remember we had Dr. Malloy come at our last study session and kind of go through all the measurements we currently are measuring, and just would ask you as individual board members to reacquaint yourselves with that chart and that work so that we can move through that on the 25th, as well as take a little time on the Portrait of a Graduate as we set up the ATM work the first week of February on that. So we'll also have Mutu work with the student board on that Portrait of a Graduate topic as well. So didn't know if there were other questions that you would have about the strategic plan refresh tonight, or another task you'd want Mutu to prepare, or Mutu and I to prepare for the 25th.
Only one quick thought, Superintendent Reed. I know you were speaking with representatives of some corporations about what their feedback would be on a Portrait of a Graduate. It'd be helpful to have that feedback if it's ready, even if it's, you know, bullet points, sketch, whatever. It just would be handy for the retreat.
Got it. Thank you.
And actually, I think that will also help us in terms of our approach as we think about, you know, how we envision the Portrait of the Graduate to go into the refreshed strategic plan. I mean, I know we've all been working through that, and, you know, trying to come up with our own perspective of what our graduates look like. So that'll be useful.
Great. So if there aren't other comments on the strategic planning refresh, I thought it would be helpful for us to have a conversation around school reopening planning parameters and all of the work that's been going on for months with staff. And last week, I was able to connect or link our reopening handbook sorry.
Dr. McGordy, did you have a question?
Actually, I was deferring to you, President.
Oh, yeah. Sorry, Dr. Reed. I was just going to say one quick thing on when we review the table, the chart that Dr. Malloy put together. You know, we're all going to review that and look at where we might have holes or gaps in our ability to measure outcomes and that kind of thing. So just hopefully Dr. Malloy and you all will also what your recommendations are, since you work with us every day, about where you're finding kind of difficulties, thinking about how do we collect data or get more input from parents and students and that kind of thing. So that's all I had on that.
Perfect.
All right. Thank you. Continue, please.
Yeah. So I'll make a note to make sure we're also have the regional assistant superintendents take a look at that. I think they have been working with it with Dr. Malloy, so we'll make sure we have that data for you as well from staff. So back to school reopening planning parameters, and just want to acknowledge that there has been just a lot of work that's gone on behind the scenes for months to prepare. And so just wanting to, we did link to the handbook, safety handbook, and have already received some great feedback where certain items maybe were less clear than they could or should have been. So we're constantly updating it. I think that's a living document. So as staff or students, families, or you find things that you think, we could have written that better, or that's not really clear, we'd sure love the feedback, and we're continuing to monitor that. So maybe we could start with that, kind of just the sort of physical parameters around, HVAC systems, the PPE, and the handbook. Just wondered if you had any questions or observations now that it's out there more publicly. I know we've shared iterations of it as we've worked through it, but just wanted maybe some reaction from you, or just honestly, this, while we're on Zoom, it seems didactic or a little awkward, but it's also an opportunity for you to have a conversation with each other about this. It's not necessarily just me or, one-off, kind of one-on-one, but it's a chance for you all just to kind of maybe share your perspective on the handbook or those physical parameters. And I'll take notes to make sure that I'm attending to the topics you want to raise.
Yeah, I'll start with just a quick question just about HVAC systems, Dr. Reeds. If you don't mind, that's not a topic that we've talked about much in board meetings and all, in terms of we have different different size facilities all over the district. And if you don't mind giving a summary where we are with the status of our HVAC systems across the district.
So it's my understanding that we continue to monitor those. We've contracted with McKinstry, which is an industrial, they also have industrial hygiene sort of parameters, and we monitor the HVAC in all our buildings, and they're at safe levels. That's one of the benefits of being able to have predictable levies that support that type of maintenance. Having said that, there's still a recommendation from the Department of Health as often as possible to have doors or windows open, or, to have air flow that's helpful. But right now, my understanding is our HVAC systems, in fact, we're just putting in a brand new one at Lockwood Elementary as, the result of a different situation. So there are, my understanding is the HVAC systems are being monitored and will continue to be monitored and are currently meeting the health guidelines.
Okay, and thank you. That last sentence, that's just what I want to confirm, that the HVAC systems are in a state where they won't prove a barrier based on the health guidelines.
We don't believe they will, though the health guidelines for maybe activities that exert more, the PE type activities and so forth might still be best done outside until we're able to really have a critical mass of folks vaccinated.
Great, thanks.
Dr. Reed, just for clarification with respect to that, this is recommendations from Department of Health for HVAC capacity with respect to protecting against COVID infection. I mean, so many places seem to have been inspecting and adding, HVAC and air, circulation capabilities specifically, to pump them up, because of the vaccine, or not the vaccine, the virus. Are HVACs at that capacity, or is it really any different from what they would normally be doing?
I will check on that, Director McGorty. I don't know that HVAC systems in and of themselves are protective in nature against the virus. I think that they're one of many strategies to help create a safe work environment. But let me do a double check and a match. And I think one of the benefits of having the conversation tonight is if that's a parameter that's important to the board, that I have that level of detailed data as part of our planning, then I'd be happy to provide that. And I'll have our capital projects department and support services, provide each the airflow quality or HVAC quality for our buildings.
Yeah, I have similar thoughts on that, just from the reading I've done and just my familiarity with commercial real estate and HVAC systems. We do, the guidelines are to, kids can go back when it's safe. If we can provide a safe atmosphere for them to go back to following all the PPE guidelines and all those safety precautions. HVAC is a tricky one, and it would be good to get more of an update on that, because it's about the circulation of air, right? It's, are you circulating contained air within the room? Is it being refreshed? Is there adequate air being removed from the room? How does that affect kids in a classroom and teachers? Yeah, we've read a fair amount about if it's not done correctly, that 6 foot rule is not really it's not a good one, or it doesn't really hold up. So it could, but it's just one of the many factors we'd love to see. I don't know if McKinstry can send us something. I know it's a tricky one because all of our buildings are so different, right? We've got central air in some buildings, and we've got kind of outdoor pods in other buildings, and it kind of depends on the age. So yeah, it would be good to get some kind of probably a deep dive into it at some level.
Yeah, I know that Dr. Paperman's indicating that we're running at maximum external air intake using the best filters possible for our systems, which are continuously running. Now, having said that, I think your point, President Swain, is depending on the age of the building and the age of the system, that maximum might look different building to building. So I'll make sure we have a chart for you.
And Dr. Reeds, while we're doing a deep dive into HVAC, another thought I have is if we do have windows open to increase ventilation, what does the HVAC deliver as far as temperature in the rooms? Is it close to outdoor temperature, or is it going to be close to normal temperature? I'm just kind of curious what that environment would feel like too with HVAC running if windows are open.
Well, in our house right now, where I've got a blanket because we've got windows open even still here, I think what we would say is I think the inside more simulates the outdoor temperature. The more air we intake from outside, the more likely we're going to simulate that external temperature for sure. And if we're keeping windows and doors open.
Yep.
I had a question around the acquiring of the PPE. I know the COVID relief fund round 2 is going to be the exact same number of dollars that we received with the first round. Do we have a rough estimate of what we anticipate the PPE costing? And so one, is that going to be anywhere enough, the dollars that we're going to receive? And two, in the last fall, there was an issue with availability of the PPE. I'm hoping that has changed in the meantime, that the providers of PPE are able to keep up. But do we feel confident that we'll be able to get the numbers that we're going to need?
We actually do have PPE. We ordered last summer, and then as the N95s became available for staff who are in categories that require them, we have ordered those as well. As you recall from our prior report, we spent close to 1.4 million on cleaning, Clorox, fogging, disinfecting, and PPE. So we did receive 538,000 in CARES money. So it only covered about a third of what we actually needed to spend. But we do have PPE available for staff. And I think that's essential for us. We need to be able to provide that minimally for staff.
Great, thank you. So just to clarify, not only for myself, but for the viewing public, the assumption will be that students will be providing their own masks.
That's what the OSPI guidance was, that students would provide their own and districts would provide PPE for staff. Now, having said that, I'm quite sure we'll need to have a stock of masks in a variety of sizes for students who may or may not forget those, because it will be mandatory to wear a mask when we return to the buildings. I think the OSPI has been clear about that as well.
So one more follow-up on that. What my understanding of the way that vaccines are working is that they protect you, the individual, from the harsher symptoms of the disease, but they do not protect you from getting COVID-19, and so that you're still able to transmit it. So do we have a sense of how long, even after people are vaccinated, where that tipping point is, where we'll be able to move away from the PPE?
I think they're still studying that. I know, for example, the Pfizer vaccine has some preventive, again, the Pfizer, Moderna, they all, there's still some research to be done because so few people have been vaccinated about whether or not they can still transmit after they've been vaccinated. But the vaccine is intended to obviously mitigate the disease for the person vaccinated. But whether or not they can transmit is still something I think that's being studied. There's a lot we don't know about this virus, right? And the vaccine, and and there's so many conflicting reports out there and directions, and it's a bit of a challenge sometimes to navigate to figure out what's actually true.
Just for what it's worth, and Director Kogan, who knows far more about this, the vaccines, than I do, that can jump in anytime. There is the issue too of herd immunity, which they are still working on. As you say, Dr. Reed, there's a whole lot we don't know, and we'll only know as more and more people get vaccinated, which hopefully, the regular testing, which I understand our district is participating in a pilot program for testing in the schools. Hopefully that will help us get to that point as well. On sort of a related topic, and anyone please feel free to jump back to the vaccinations, but sort of related, we had talked quite some time ago, and I'm sure continuously since then, about cleaning protocols for the schools. And for example, when we go back to or jump into a hybrid schedule, there would be a day where we have the schools available for intense cleaning. Is that still roughly the plan with respect to keeping the schools clean?
So Director McGorty, I think there's no question that keeping surfaces clean is really critical. It's an important part of the guidelines from the Department of Health, hand washing, mask wearing, or face coverings, keeping surfaces clean, all of those are critical for sure. And I think we tried to always keep our buildings clean, but this is certainly a new level of clean, and the types of equipment and products we're shifting to using all demonstrate a different attention to a different level of clean.
Dr. Reed, just can you, I know you do so much reading on this as we do too, but can you maybe share your thoughts on other states and especially other countries who, they kept kids in school and did a fairly good job of it with PPE, but although they were at much lower infection rates as a country or as communities, way lower than we've ever even dreamed of reaching. But a lot of those countries have now shut classrooms down, or they've closed schools, open schools, closed schools. Can you maybe reflect on why you think that is? And then more importantly, I've been doing a lot of reading on the negative effects of opening and closing on students and families, of course. Just the change of schedule, loss of teaching hours when you go to a hybrid system, because you've got transportation, you got to do their half days, because we don't have our classrooms, and especially in a big district, we don't have enough room to provide 6 foot of distance for a whole class, how some classes need to be split with other teachers. But I guess there's 2 questions there, roughly. What's your view on why other countries and other states have closed, or the city of New York, even though they did use proper PPE? And then also the negative aspects or consequences of kind of going in person, not in person.
Yeah, thanks, President Swain. I think it's a good question, particularly given how close we are to the vaccine distribution. It is disruptive every time you gear up to pivot to a different learning modality. And I know I was on a call with other superintendents from around the country last week, in particular Pennsylvania, Oregon, and Tennessee. And in all cases, they were all remote at this point. In Tennessee, they were in person for a while this fall, but in November had to close, because what they realized is the community transmission rate kept rising as the schools stayed open. And once the community transmission rate rises too high, obviously, then the hospitalization rates start to come into play, and then it just becomes too dangerous. And I think it's really been, there has been no, what I would call complete testing done in the United States in terms of research that we can find. And I think the Gates folks are going to share that when they join us next on the 25th. But a lot of the testing programs have been sort of sporadic or voluntary, or sort of not, how do I say this, that they based on symptoms. So they weren't necessarily testing for asymptomatic distribution as well. And New York actually has done a great job of figuring out how to do different types of testing. And again, you'll hear more about that on the 25th, so that the asymptomatic, I think what they found was that there are more students asymptomatic than they had realized actually had the virus. I posted an article from Austria to answer your global question, which is they actually realized that children, there were a lot more, like they had closed most things but left schools open, and they still couldn't contain the virus. And I think they were able to then test kids and realize that as kids came together and went back home and came together and went back home, the virus continues to grow. And so schools are not islands on their own, right? We are connected to the community. So that transmission rate is an issue. And I would say, even though we want to think about planning for return, the variant of the virus is also a consideration right now, because if it's true that it's, I don't know, 50 to 70% more contagious, that's really problematic. I just think there's a lot of thought still as we work forward. And at the end of the day, I know there are some recent letters that have gone to the governor from legislators, and educators all over the country are really, I think, expressing the concern about needing to be vaccinated before they return to the classroom. And I think that there's I think there's some really good research that would indicate that's important, because when they're there all day. It's not an in and out. Many people, I think, are continuing shopping and those kinds of things for groceries, but a 7-hour, in a building. I think if we can, and I know February is sort of the governor's plan, although I think they're still making adjustments to it. But to your point, I think there's a lot to be learned yet about how kids transmit the virus. Even if they don't get as sick, their ability to transmit it to adults. I think if we can't get the vaccine distributed quickly, it gives more mutations an opportunity to happen, which is problematic. More variants, I guess, for lack of a better term. And I think the shift back and forth, there are also families who have said it's really been disruptive for students to start and then stop and then move back and then stop. And we really want to have a predictable, smooth experience for our students. So all those factors, I think, are important to consider.
Thank you, Dr. Reed. Appreciate that.
So I'm not sure, Dr. Reed, if you want, because you started our conversation by talking about, let's talk about facilities and physical. I have a question, but it's out of there. So do you want me, I don't want to get us on a tangent. So
I think anything's fair game, right?
Okay.
Go ahead.
Okay. All right, great. Well, so this one I'm wondering is for you to go into. I'd love to have a conversation on the plans for what we've called at some points academic restoration, but kind of the broader conversation on focusing on teaching and learning during the pandemic. There's a lot of sub-bullets under this. So academic restoration, we know there's not going to be a knight on a white horse coming in with a bunch of money to help us do compensatory services, right? So we're stuck in this spot where we are looking at ways of tracking what's going on with students and implementing our multi-tiered systems of support and all the tools we have in order to support students' academics. So just kind of a general overview with that teaching and learning focus. And then my other sub-bullet is I'd also love to talk about some of that kind of outlying cases. We know that this pandemic, like in all aspects across our country, it's affecting some populations in much more severe ways than others. And, talk about our work around that, and even some, unique things to education, like seniors, and folks who might be at the end. Special education students are close to the end of their time with us. So if you don't mind, if this isn't too much of a tangent, let's chat teaching and learning.
Sure. I do know that that's correct. We do have some students who are struggling more than other students, for sure. And there won't be extra funds, which is in part why it's so important that Director Hayes talk about transportation and the maintenance of those funds. Because if we aren't able to maintain the transportation funds, then we have to take funds that we would otherwise be using to support compensatory services or recovery services or extra supports and pay for transportation pieces. So it's really important that transportation come through. Having said that, there are, teachers are working right now to connect with families and provide supports. We're actually looking at an online tool this Thursday, as I've mentioned, for, our dyslexia screener and possible intervention supports right now. I think when we get back to classrooms, we're going to have to actually talk about how teaching and learning even looks different, right, than what it has looked like, because it's going to be quite an adjustment, I think, and really an emotional adjustment as well, because we're not going to be, I think there's a feeling that when we come back, it's going to be like it was. And for quite a while, it won't, right? We still have to maintain the 6 feet, and we still have to wear PPE, and it won't be the same. And just making sure we're prepared for that, and are able to engage in, small group work when the group is, really spread out. So it's going to affect some strategies. But I think we're gonna do what we do in North Shore, roll up our sleeves and support students' social emotional needs, and the academic needs will also be addressed and taken care of. But I think we're gonna have to look at the calendar. Is there something we can do this summer potentially, assuming we can have staff vaccinated by summer? We're also establishing a committee that's going to be looking at how we're coming back to school, talking about how we are building a ramp back to reopening, and a bridge back to the classroom. Those are all important things. And it's not just to the physical classroom, but to that learning space within a classroom that's going to look different for a while. So I don't know if that answers your questions, but we've continued to do our internal assessments, the iReady and those types of things, even though we're online. So we have a pretty good feel for where students are, and are continuing to support students with that work even now.
That's great. So I'm gonna follow up on some of my little sub bullets here. So, this with the caveat that this is a pandemic and there's lots of things that have resulted from it, including, we know parts of our district have had, I've seen charts where, layoffs have impacted a lot of our districts. And, part of me is thinking about the equity work. I know we've built our support services, our student services team, in cases like that. But in terms of our focus on students who are getting who are getting more impact than others. We know families, who might have some essential workers in their families, right? And cases where students, maybe older students, are having to shoulder a lot more responsibility than they were having to in their household pre. And I suppose I have a very general question that might not have answers right at the fingertips, but I'm just trying to get to the equity question around teaching and learning and get your thoughts. I know a ton of work is being done, but I want to raise it so we can talk about it.
Yeah, I think it's work we were doing even before the pandemic, right? And then the pandemic has exacerbated it for sure. What we do have, like I said, a committee that's working on that. What pieces would you want to make sure that I came back to you with, that we've made sure somehow we've interrogated or checked, or maybe what kind of data would you like? Or I'm just trying to think of how to frame this as I work with staff and cabinet on, because I know each school has their strategic plan, very focused on this. Skyview today, we went through, I would say, they had some students that hadn't been engaging as much in their fall meeting, and they've gave, really detailed reports of how each of those students are doing now and the interventions they're trying. They've created different staff teams that work with families and students, and same at North Creek. So I think each building is crafting solutions, and then there's sort of this district push to just stay really attentive to all of our students, both the students struggling and the students who are it seems to be working for, and we look at a grade, if students' grades are fine, we think it's working, but there may be social emotional issues even if grades are fine. So we're trying to make sure we're very attentive to that whole child to make sure, regardless of the academic performance, that our students are, doing okay. So I'd be curious to hear, Director Cast, maybe a little more from you and the other board members on what you would want me to make sure I share with staff.
So I guess to help and this is, my question, I'm glad we have all our peers here to get everyone's take on this. It's, when looking at reopening parameters, using our strategic plan as a way to talk about optimizing results for students. I can't think of a better lens or filter to use than our strategic plan when we're looking at supporting outcomes. So it's
I agree.
It's probably like a lot of other conversations around the pandemic where it'd be handy to have the magic wand and be able to, my ability to talk about my concerns sometimes is just that, but being able to, having our ability that when we're working on the reopening parameters, to have that be front and center, that the students, and I'm sure we all could, list groups of students, and actually I'm sure it's down to an individual level, identifying students who are being impacted and getting them the help they need as quickly as we can muster. That's my request for a reopening parameter.
Okay. I'm taking notes.
I could just jump in a little bit, Director Cass. Thank you for pulling us in this direction. You virtually read off of my sheet of notes of things that we should be talking about. First, I want to call out Dr. Mcdowell's report on North Creek High School mid-year update that came out today. It was so thorough and the evidence so compelling. One with respect to how they are monitoring their students and all of the efforts that they're putting in to track what's going on with the students, as well as some terrific ideas of, okay, we're kind of in a stranglehold right now. There's only so much we can do. We're trying to get to the point where we can do more. But he also had a list of what I thought were great ideas of things that could potentially help and potentially contribute to remediation of the learning loss that's going on for some of our students who are furthest from educational justice right now. I think whenever I think about reopening, I guess maybe just going back to school in general, one, I think equity has to be front and center, top, first most of everything that's going on. And I think of that in terms of disaggregation of the data. It's individual students who are struggling, and there are reasons why they are struggling, and take that personal approach, which I know our teachers and staff are doing. And my train of thought just went straight out the window. But equity being at the top, but also not making a point of not putting aside everything that we have learned in the process. Online learning is doing so much for so many kids, and so many kids are thriving with it, and having that available, perhaps even for some of the, I keep wanting to say makeup, but the learning loss, helping students to overcome some of the learning loss, having all these extra tools that you have put in place during the lockdown, I think would be a really important thing to continue.
Just a thought too, probably obvious, but everybody's been affected by this change that COVID's had in our community. And I think all the students coming back to the classroom when safe to do so are going to feel a real need to reconnect like that. And I think that what we're going to see, like we did with the online learning, is even our best planning is going to have to be tweaked and adjusted as we learn and find out that certain issues become factors that we didn't quite figure they would be so impactful, and then other things may go more smoothly than we planned. But I think that's part of it too, is just being ready to acknowledge that we're going to have to continue to iterate, as we get back into the school classrooms.
Yeah.
So I had a question. You've done a very nice job of keeping us informed on iReady scores, grades, and so that we can monitor and see where the areas of concern are. My question is for reopening. When we see a student that is struggling to grasp a concept in a subject area, or is struggling academically in terms of their grades, attendance, or not turning assignments in, what are strategies that we use that can only be done in person versus strategies that we can be using remotely, so that we're prioritizing, okay, those are the things that we have to do for that academic restoration that Director Cast asked. And then likewise with the social emotional learning, what are things that we do that we can be doing remotely versus what are things that we can only do in person?
Okay. Yeah, that makes sense. I think that's a great question for the committee to wrestle with too, right? Because I think we've discovered we can do a lot more remotely than we thought, but still not everything.
Mm-hmm.
And I'm sorry, with my sub bullets, a sub bullet for that, it's I'm thinking of a way to word this that isn't like so incredibly vague and stuff like no, like no help. But the idea that what can be done, I'm trying to build off of what you were saying, Director Hayes, what can be done in person versus remotely. In terms of all the work we've been doing with inclusion, the PYP and Ruby Bridges works, and perhaps we can build on some of the innovation around inclusion with our special ed students that can really help us at this time. Perhaps, help us shift from such a dichotomy in terms of what we can do to support another group that we know is impacted a lot by the pandemic.
Okay.
Dr. Reed, just another thought that crossed my mind. We have when people go through a loss, the stages of grief, and that's kind of documented how people process things. All of our students have had loss in this time. And I think when they come back to school, I wonder if there's any kind of insights from the mental health perspective or counseling perspective on what are some of the things that we can do to help support the return back to that, the new normalcy. If maybe nothing, maybe you just jump back in and everything's fine. But I suspect there probably are some ideas that, kids will really have some feelings that they may need to process even returning back to school.
Director Kogan, I think both the students and the staff, right? And when we talked about what's a bridge back to the classroom, how are people going to feel safe? And that's where vaccines, obviously, I think if we can have staff vaccinated, that'll make a huge difference. Testing, contact tracing, appropriate PPE, all of the pieces we've talked about. But even then, there's been trauma, right? And to your point, I think we need to be thoughtful about how we process that as we return to more traditional routines and spaces.
in my readings of other countries, when they returned to school, one of the issues that was raised was the stamina, the ability to stay engaged in school for a 6-hour stretch. In person, I mean, in person takes a lot more. There's a lot more stimuli, so it's more exhausting. And so, we think, if you remember when our kindergartners started school, what that Friday evening was like after that first week of kindergarten. But some thinking around how do we stair step that so that we help both students and staff build that stamina to deal with all that external stimuli that they haven't been dealing with over the last year.
Yeah, it's been a long time. I think we're coming up on a year here shortly.
Dr. Reed, could you, I was thinking about our planning that you've been doing and around, for students and staff and faculty, based on a hybrid model, which we know when it is safe to go back at some level, it's going to have to be hybrid, because from what we know, there are numerous families that will not send their kids back until they're fully vaccinated, because they have either for just basic health reasons, but there are plenty of students and staff that have health considerations in their home, either older parents or parents with morbidity issues. It's a significant amount of people. So how does that look with staff and families that can't be in person?
Yeah, so we've been hopeful that our learning management system will help support that process, because that was intended and is intended to be the backbone. So whether you were in class or at home, that, would provide access. But we know it's very likely we'll need to add resources of some sort to support staff in trying to meet the needs of students that are in their classroom. And then what does that look like for the students that aren't in their classroom, right? So we're looking at potential technology solutions, but it may come down. I know a number of the districts that have taken the opportunity to reopen have added staff. And again, if we end up needing to add staff, or that requires resources to do that, which makes the transportation conversation so critical again, and the maintenance of the MSOCs, and hopefully the addition of the next round of CARES money, because adding staff, is a financial commitment. So it's just trying to find the right balance for our staff who have never worked harder. The amount of time and effort to create lessons for this online environment have just been profound. And we've learned a lot of valuable things, but it is definitely, I can share that staff would love to be back in person and have a new appreciation for the lives we had even a year ago, right? I think the different types of hybrid models also might look differently, elementary versus secondary. Many of our secondary students are able to navigate the online somewhat satisfactorily. And we're also looking at how does that mirror post-secondary education that uses blended learning. But we're still, the devil's in the details, and we'll see how many, as we look for each group of students that we're thinking of potentially bringing back, we need to survey to find out, because one of the things that's happened, you noticed in my note Friday, we have to go back and re-check in with families that we checked in last October with, because we keep getting emails that people have changed their mind. The variant now, the increased rates today than where we were in October. People, it's such a different scenario. So it doesn't really serve us well to survey everybody in September, because by the time we're looking at potentially bringing some groups back, a lot of families have come to different decisions. So we're just, we'll take a look at that and I just kind of see where we land.
Thank you.
Yeah, no, I appreciate that flexibility. I know more than a couple districts that asked for, public school districts that asked for a commitment in September. And even though their hybrid strategies got delayed, are still, asking families to stick with that September commitment. And I appreciate the flexibility. It adds more work to staff to constantly have to re-ask, but I really appreciate that flexibility. And one thing about the cost too, Dr. Reed, as we look at this, I remember when you were testifying with the Senate Ways and Means Committee, and there were a couple other superintendents on that committee hearing, the superintendent from Spokane, and this was in December, was it early December?
I think so. Memories.
Yeah. They had already spent $9 million extra on reopening. And so I keep thinking, well, our English language arts curriculum is $2 million, and start time improvements is 1 to 2, depending on the final option. And there's things, and so obviously with the financial implications, that would be obviously a parameter that the board would have to weigh in on. If there's anything significant that would put any of the ELA curriculum and the start time are both in superintendent parameters the board has set out. And so we'd need to understand any impacts to that.
Well, and I think the addition of staff is a large impact, and the additional perhaps substitute needs as well, because so it's a big question mark at this point. And we want to do it right. We really want to stay focused on students and do the best we can. So it likely is going to cost more money.
Right, for sure. Thanks. It's planning while balancing on the tip of a pin. So thank you.
Right. And I think while we're planning and trying to figure that out, even if you're doing some kind of hybrid, your ridership and transportation, hate to keep going back to that, is not going to be what it would normally be. And in fact, you sometimes are double running routes for morning and afternoon sessions. So you're actually doing more potentially with less funding, which doesn't, that's not going to be helpful. At the end of the day, we can't proceed. We have to really be thoughtful about this pandemic and remember what's most important, and that's health and safety.
I'm hoping to clarify the understanding around why substitutes increase. My understanding is it's because in normal times, a teacher, staff member may be out for 2 or 3 days due to illness. With COVID, even if you're not sick, if you have to go in quarantine, it's easily 2 weeks.
Right.
And so that's why is that correct? That's why the substitute clause, we need more substitutes.
That's correct. And also the substitute pool could be a limiting factor. All districts utilize substitutes. And as we all think about coming back to school, if, a lot of the substitutes go to different districts, they're not district bound. And some schools have had to close back down again because they weren't able to find enough staff to staff the building. And that's a real concern, as we think about the health and safety of our students, staff, and the community. Which again points back to educators getting vaccinated, in which case we wouldn't have these extended quarantine times if we had our educators vaccinated.
So for us as a board, as well as community listening to this, what can we do to help move educators up earlier in the pipeline?
I think connecting with legislators, the Department of Health, the governor's office, I think is where the decision sits right now, I believe, in the State Department of Health with the governor. And, rather than have 295 districts try to figure out how to get people vaccinated, it seems like it would be nice to have one strategy that's very clear. Our school nurses, for example, are being vaccinated now. They're in that early session and they are school staff. And we would, advocate for all educators to be vaccinated before we return to the classroom. So I would even say if we are thinking about elementary schools in particular, because that's been a concern in terms of accessing technology, golly, it would sure make more sense maybe rather than to put an age for educators right at the beginning, maybe to have like all elementary educators or folks, drivers and support staff that would support younger children might all be in the same flight sooner, because otherwise it's sort of like the Swiss cheese, right? Some people would be, some people wouldn't, and that's going to create a whole nother, well, it already has created a whole nother conversation, which isn't helpful. And I think the public, if we could, really share that we want our educators to be safe, I think that's a helpful advocacy at this point. It's imperative.
And sorry, just I follow up on that one logistical, very much in the weeds and out of my swim lane question. But in the past, the district has had flu shot clinics. Is that even a possibility for the district to be a host of a COVID shot clinic for staff?
We did hear just this afternoon from one of our hospital partners in the region that they were willing to come and set that up for our school nurses. So I think that we would love to be a vaccine site. And if that would be helpful in the distribution, we just know that the clock is running on our school year as well. We'd like to get as many educators vaccinated as soon as possible to have as much of our school year left. And the sooner we get folks vaccinated, the less likely we have these sort of mutations or new strains. And I think that's important. But Director Hayes, I'm hopeful that we could, make this more streamlined, because if we have to do it on the flu shot, it's so much more efficient to do it at school or at work sites. I noticed Amazon and the Seattle Times had an article where they were immunizing a large number of their workforce, I think 20,000 or something, at their work sites where they were mobilizing. So it just seems like doing it at the district sites would make a lot of sense.
Thank you. Sorry, Director Cast.
Oh no, I'm sorry. The lovely Zoom slight split-second delay where you inadvertently step on top of people. But that topic has come up in the Friday collaboration calls that President Swain and I are on for the East King County school districts, because there's two efforts here. It's the reopening effort, and then there's sustaining the thing we call education in a building effort. And so it's one of those, having the infrastructure there to make it so there's less pulling kids back and forth in between classrooms. So if you notice, Superintendent Reed, any need for advocacy there, we've already been mentioning it. We're not shy about mentioning it to legislators, but the King County Department of Health comes up on those Friday calls, and you've been able to support us with that. But I think you're right. I think it's with the governor's office. It's in the State Department of Health is the one making the call there in terms of who's in which vaccine phase.
Yeah, Director Cass, good point. Yeah, Dr. Reed, I can't remember if it was Bellevue or Issaquah. I think King County had reached out to one of them that had one of their high schools had enough traffic flow, an ingress and egress, where they could put a drive-through clinic, drive-through vaccination effort there. So I think if someone from staff might reach out to King County Health, if we have an ideal, one of our high schools is more ideal than another, we might just throw it out there.
I think we have, but I'll check in to make sure if we have, do it again and again. Yeah, I think it's a logistical challenge right now.
If I could follow up questions that I don't know if anybody here can answer. Just thinking about when our educators might be vaccinated, and those people who have reached out saying they're either unwilling or simply afraid to come back, whether it's staff or parents not wanting to send their kids. And also, knowing some healthcare workers who have been vaccinated, it's a priority when, for the healthcare workers, but also for their families to be vaccinated at the same time, because it's not going to do a lot of good if our healthcare workers then go home and, infect their families and or bring it back to the workplace. So I'm wondering if anybody knows, are there plans for when the teachers get vaccinated that their families would also receive the vaccination? And then the other people at the top of my list, if we're going back to school, is our bus drivers. They're not standing in front of a classroom, but they're going to be very close with our students for a lot of time. Do we know if they are included with the educators with respect to timing of vaccinations?
I would expect them to be, Director McGorty. I mean, I would expect that our drivers and any education staff that are spending time with students would be in that group. Okay.
And the other question, again, I don't know if it's really a question or just something to kind of throw out there. I'm glad that you brought up the potential need for adding more staff. If we have, families who, clearly there are families who want to have their students back in person, but there are also clearly families who cannot or do not want them to go back, at least yet. And so we're setting up a potential dual system where some students are in person with their teachers and some students are online. Having more staff to cover that is going to be absolutely necessary. But do you have any concerns about maybe, I'm not exactly sure how to frame this, setting up or continuing a sort of dual educational opportunity system when, for the kids? Are we certain that the kids are going to get the same instruction? Obviously, different teachers teach differently and they can be offered the same courses, but do we have any concerns about equity with respect to setting up the system that way?
Well, I think, our intention is to try to, again, I think part of this jigsaw puzzle, if you will, and most folks are talking about it really primarily with elementary children at this time, but is that, we want to try to figure out how to provide the best opportunity and try to figure out what's also the most actually doable without utilizing all resources before we can get through this time, and without knowing exactly where the legislature is going to move with funding and that type of thing. So there are a lot of moving parts to balance, but our intent is to keep the quality of what we're doing as high as humanly possible. I can't say that I would equate online with in person. They're very different. There are children who have thrived in the online and children who have really struggled. And children who've not been able to access at all in some cases. So, but if families make a choice to stay remote when we have an opportunity to go back, we still, will do our very best to figure out the best ways to support their student, whether they're remote or in the classroom.
Thank you.
We can't set up a completely dual system. So,
thank you, Director McGordy. That triggered a thought. And coming off of our P7 conversation around the student learning environment, unfortunately and weirdly, the COVID and its existence and how we deal with it has become a topic where we demonize the people that think differently about it. And I worry that we will have students on in person or remote that will say negative or perceive the students, whether they're remote and the students in class, that they're wrong, and vice versa, and things will be said. And are we starting a conversation about how to navigate that conversation so that it is not the parents in that household is wrong for making that decision about the environment that their student is receiving their education?
Yeah, I think that's an interesting point, isn't it? I think civility and kindness, how we treat one another, is important wherever our learning space is. So I made a note to make sure that we underscore that. I honestly think the kids are better at all of this maybe sometimes than the adults are. So I suspect that we're going to find that students will go, okay, that they understand, or some students may be able to come for part of a day, but maybe not all day, or and for a while we just have to extend grace to one another. And I think, as you would agree, hope everyone has the best intentions, and I try to always believe that. And sometimes where we, stray, it's out of fear sometimes, and we're so close, I think, to getting through some of these major issues with the vaccine now available and hopefully distributed soon. We're into this almost a year, and it's just so important for us to make sure we maintain that focus on health and safety as we get so close to being able to return to more traditional spaces and routines, and try not to have too many disruptions between now and then, because we're so close. Try to stay really measured and pragmatic about returning. So, golly, I hope we're not going to be adding unkind rhetoric to that as well. So, point taken. I'll make a note of that.
Dr. Reed, going back to the transportation issue, I know early on there was a lot of unknowns as far as, what can we do per the parameters set forth by OSPI and the Department of Health as far as distancing. But at the same time, there was L&I regulations about you can't put plexiglass in a bus between seats, and trying to create buses to be a somewhat safe environment for kids. I know we were looking at options and then potential costs. So have we been able to wrap our head around, or even get any good guidance from L&I?
Yeah, the school bus thing was like I just wanted to stab my eyes out. I mean, here we know that the drivers need to be protected, right? And the metro drivers and other drivers have the plexiglass, but the State Patrol has some pretty rigid guidelines on what you can add inside to a school bus. So it's that, thank you for mentioning that, President Swain. It's almost like the rules and regulations haven't caught up with the pandemic.
Mm-hmm.
In some situations, same early on with our, insurance and the health department recommendations and that type of thing. So, yeah, I think we're still going to have to work on that and make sure our drivers have the proper PPE, I'm not sure. I have to check with transportation on what the status, maybe the State Patrol by now has shifted a little bit on shields for drivers. I don't know. Let me check on that.
Thank you.
Yeah, we've actually, we invested in the PPE for them personally, but just doing a double check on that.
Okay, thanks.
You bet.
Dr. Reed, on a somewhat related note, President Swain reminds me of the fact that we cross into 2 counties. We have different health departments and different regulations. Is that causing potential complications with respect to how and when we open things up in our schools on different sides of that county line?
Yeah, the 2 counties, I think we're one of the unique districts, honestly. There aren't that many in the state that have data from 2 different counties, 2 different health departments. It's nice that the governor kind of has these regions rather than counties for the phasing, although none of it applies to schools. But it is clear that there are different, we have staff that live in one county and work in another. We have students who live in one county and go to school in another county because of our bus routing and our neighborhoods. So it has been a bit of a challenge. And we just continue to work with both counties and attend double meetings and that kind of thing. But it does present a unique set of challenges.
Well, we're rolling into an hour and 42 minutes. Do we have other topics top of mind that we want to, before we wrap up? I don't want to close too early either, so.
The only other topic I had top of mind is Superintendent Reed, for when we have the in 2 weeks, when we have the Gates Foundation folks coming to explain the testing pilot. So would you like us to come with, have our questions ready and come again, in terms of that, just setting expectations for that meeting for the board?
Well, I was planning to send a note out in our Friday brief this Friday for you to maybe, if you have questions, if I could forward it to them ahead of the meeting, that would likely enable them to make sure if they need to grab data or something to prepare. I have a new PowerPoint that I was just sent that has some templates, which I'll share with you this Friday.
Okay, great. Thank you.
And I think you saw the chart, Director Cass, that I sent last Friday with the varieties of types of tests. And I think one of the things that's really important to think about is it's not really, for me, it's not just about opening that requires tests, but it's about our ability to stay open. And I think Director Kogan mentioned that earlier as well. I think what we want to do is have as many systems in place that once we make that lift, that we're not back home again, right? So the virus is going to be around for a while. It's even when everyone's vaccinated and there's herd immunity, it's still going to be around. And I think maintaining some level of diagnostic testing will be important for us, and our ability to react and respond to that as a system writ large is going to be really important. Because the idea is we want to stay open once we open, right? This has been a relatively miserable experience, I think, for many of us, because there's just there are no easy answers. There are no clear directions. It's just been it's been a real interesting time.
Agreed. Thank you for that. Yeah, I'll definitely send you any questions I might have.
Yeah, and I've received some questions from the community too, which I've forwarded on, so that my hope is that when they're here, they're able to, respond to some of the questions as well, because it's important that the testing protocols work for us as a district in our community. And I know they're looking to do a full, even evaluation of the model potentially, so that we can be really thoughtful about what makes sense moving forward for our state.
Dr. Reed, I just wanted to say I really appreciate you and staff getting us involved with that study, because I know it's a select, was it 11 or 12 districts to start the initial testing study, and I really appreciate you getting us up there. I know The reason other countries have been able to keep schools open or open schools was because that they had testing to go along with it, and they wouldn't think twice about opening without the testing protocol, because it's so important to try to get better information about community spread, and do kids bring COVID back to their parents. It's so important. So thank you for moving us up to the, somehow you worked your magic and got us in there first. So thank you.
Yeah, you're welcome. I think it's a team effort, and you're right. The testing and contact tracing is critical to being able to stay open, and to thoughtfully stay open, right? Utilize our resources well. Yeah, it's important. So I appreciate all of us being in this learner stance on this topic. It matters, and we'll get through it.
So anyone else have any last thoughts or questions before we adjourn? Okay, well, we thank you so much, Dr. Reed. So much to talk about, and
I have one.
Oh yeah, go ahead.
We had, in fact, several of you and I talked about it, and then we totally forgot. I made it in my notes and almost forgot to bring it up. Just the athletics and activities. I know we've gotten a lot of questions from music, band, and athletics, and those types of activities. I think WIAA came out with a statement, and I know our Deputy Superintendent Dugan Harmon and our athletic directors are going to be connecting with the conference, the league that we are part of, to come up with some guidelines about what makes sense. So anyhow, just want to let folks know it's not like that's not on our radar. It's on our radar, and people are working, the athletic directors are working with folks to think about what the best path forward for that is.
Great, thank you. Well, more to come. We appreciate all the updates and the discussions that we have every week with you. And we're looking forward to more as far as planning, and especially the Gates Foundation meeting at our board retreat on the 25th. So with that, I will call this meeting adjourned. Take care and stay safe out there, everybody. And we'll